Guys, welcome to Pen Dentistry. Hope you are doing good. I am Dr. Aishwarya with you for easy learning and better understanding. If you haven't subscribed to my channel yet, please go and subscribe to my channel and learn the dentistry in an easy manner. Today we are going to learn about the periodontal packs. What are periodontal packs? The packs which are applied after the treatment of the periodontal diseases to protect the area of the surgery. Okay. So, periodontal packs. The definition of periodontal packs are productive material. That is some kind of material is applied over the wound part. Wound is the area where you have operated. Okay, the area which you have operated, that will be the wound. Over the wound created by periodontal surgical procedures. The wound which was created by the surgical procedures, the surgical procedures which you have gone through, and because of that the wound is present, or because of that the wound has occurred there, so that wound will be covered by the productive material, that is periodontal packs. The note is, this periodontal pack has no curative property. That means they don't cure the wound, but they assist the healing. Assist the healing means they don't have any medicated property of healing, but they help in the healing by protecting the tissue rather than providing the healing factors. If the surgery, if this is the tooth, and the region around it has gone under the surgery, so these area will be covered by pack, so that because of the mastication or anything which the patient is eating or taking, that should not cause any irritation on this surgery. Okay, so to provide or to protect it from these many factors, that irritation, these kind of irritation, we are applying a periodontal pack, and this periodontal pack will going to provide, or it assist the wound. It does not help in healing, but it provide a protection. The advantage of periodontal packs are, that is what it do, it protect from trauma during mastication. If a patient has gone under the flap surgery and has applied, the doctor has applied a periodontal pack on that, and to to protect the wound, we have applied a pack, so protect it from trauma. The trauma will going to occur while mastication, and because of that the wound may get a chance to bleed. So to protect it from bleeding and many kind of infection, you are going to apply a periodontal pack. The second one is, it minimize the post infection, that is the infection which is going to be happen after the surgery, that will be minimized. If there is a occurrence of infection by any kind of factors after the post surgery, that will be minimized by the periodontal packs. Post operative bleeding, the bleeding will be minimized, because after the pack has applied, there will be no chances of trauma on the wound site. There will be no chances of trauma. You can't make a trauma on this wound because periodontal pack has applied there. Okay, so there will be no trauma, there will be no bleeding. Comfort to patient. Comfort to patient means the patient can easily take any kind of food. If a food is irritant, that will not going to cause irritant on the wound side, because of the periodontal pack it will going to protect it, so patient is having a comfort. There will be no force or any kind of trauma will be seen in the wound, and this will say that the patient is comfortable. Okay, preventing, it prevent the formation of excessive granulation tissue. Granulation tissue, it is formed after the wound has made, and the wound when gets healed, while the process of healing, the granulation tissue form. So to protect the excessive granulation tissue formation, the periodontal packs are applied. It maintains a close adaptation of mucosal flap to the underlying bone. The mucosal flap and the underlying bone are packed and they are in a close adaptation because of the periodontal pack. As you have applied a periodontal pack on it like this, so it will going to protect it and it will going to make a close adaptation between the mucosal flap and the underlying bone. If this is the mucosal flap and this is the underlying bone, if you have applied a periodontal pack, this is the periodontal pack, it will going to hold the things in the position and it will maintain a close adaptation. Okay, so this is the meaning of the this line, last one. The types, there are two types: zinc oxide eugenol and the second one is non-eugenol packs. In zinc oxide eugenol, here the zinc oxide and the eugenol are mixed. It is in the liquid and powder form. L is the liquid and P is powder form. The zinc acetate here works and it provide a protection. Zinc acetate is present for the proper working time or better working time for the zinc oxide eugenol pack to set. The example is Wonder Pack. We use mostly Wonder Pack. This is the example of zinc oxide eugenol pack. It comes in liquid and powder form. This mixture are mixed when you are going to apply the pack. If you want to apply the pack, at that time only you are going to mix the liquid powder and you are going to set on the wound, above the wound. The second one is non-eugenol packs. Non-eugenol packs they are consist of metallic oxides and acids. They comes under two tubes. One is containing the oxide and the other one contains the acid. The example here is Copac. Okay, the the tube which oxide, they are with the zinc oxide and lanothiodol. Okay, lanothiodol, these are fungicidal in nature, and the second tube is consist of non-ionized carboxylic acid and chlorothymol. This is the bacteriostatic in function. So these two containing the zinc oxide and lonothiodol, and the second one is carboxylic acid and chlorothiol. In non-eugenol packs, the equal are taken and then mixed with each other and the pack is made. In zinc oxide eugenol pack, it is a disadvantage here that it is having a burning pain sensation and it gives a redness on around the wound area. This is the disadvantage of the zinc oxide eugenol pack. It gives a redness around the wound area and it provides a burning pain sensation. The properties of periodontal packs are, that means which property it should be having, so that you can apply a good and you can select a good periodontal pack for your surgery. Dressing should be soft and have enough plasticity. Dressing should be soft, that means it should be soft in nature and have enough plasticity. Plasticity means here, that means while making a pack, it should have a good molding property. Okay, good molding property is the plasticity and flexibility. It should be flexible to make so that you can make it easily to facilitate its placement in the operative area, and it should be flexible so that you can stretch and apply easily, or you can give this shape of your own choice, that is plasticity. operated area or allow proper adaptation. If it is having a plasticity and flexibility, so because of this property, you can give a proper adaptation as you want to in your healing area. Rigid to prevent fracture. It should be as much hard as so that it could prevent the fracture. If any trauma is causing, it should be prevented by the rigidity of the periodontal pack. That hard it should be. Hardened with reasonable time. It should have a good reasonable time of hardening. That means if you have applied a pack on wound, so it should not take more than time so that it will be difficult for you to apply, and if it is hardening at a very faster, so that will also cause a problem. And it is, if it is hardening, it is taking more time to harden, that will also going to make a problem for the doctor. So it should have a hardening time with a reasonable time. Smooth surface after setting. It should be giving a smooth surface so that it should be easy and it should be comfortable to patient. It should be applied and comfortable to the patient. It should prevent a lip and cheek irritation. If the surface is rough, it will going to provide a irritation on the lip and cheek area. If the surface is smooth, it will not going to provide, or it will not going to make a irritation on the lip and cheek area. So it should be soft, smooth and prevent. Okay, preventive. It should have a bactericidal property to prevent the excessive plaque formation. As this pack is placed in the mouth for a longer time, so it's because of the longer time there will be a chances of food accumulation. So because of the food accumulation there will be a plaque formation. So to prevent the plaque formation, these packs are having a bactericidal properties. It should not interfere with the healing. Interfere with the healing means here that it should not react with the wound, or it should not prevent the healing. No anti-reaction should not be there. Retention. Retention is if the dressing are kept usually in the place. Here what you are going to do for the retention, for the placement of the pack on the wound. Dressing are kept usually in the place of mechanically by interlocking the interdental space. You are going to lock the lingual as well as the facial side. This is the facial and the lingual side you are going to lock, and the interdental area will be involved. If this is the jaw, okay, if this is the jaw, so lingual and the labial area will be covered like this, and the interlocking will be done in the at the interdental spaces. To protect the placement, to provide a retention, you should apply a splint and smash around the tooth so that the retention should be made on the tooth and the wound area should be protected. These are the retention part. These are the properties of the periodontal pack. Now we are going to see how it is applied and how it is prepared. Now we have come on the last step, that is how you are going to make and how you are going to prepare and apply the pack on the mouth, in the mouth region or the wound where you want to apply the pack. This I have told you, this pack is mixed equally, the paste are mixed equally, then the paste will going to be placed in the cup of water at room temperature for about 2 to 3 minutes. What you are going to do here, you are going to make a pack, you are going to mix it, and you are going to place it in the cup of water at room temperature. The water should be at room temperature. And for what time? 2 to 3 minutes. When pack loses its tackiness means changes will be seen to you, and that time it is ready to use, then you are going to roll it into a two strips. Approximately the strips will be there. You're going to roll it with the two strips. This will be the approximately two length treated. The length which you are going to be, which you have done the treatment, it will going to be of the two strips will be of that length. Okay. So now you on a buccal surface, if this is the tooth region, if this is the tooth, okay, this is the buccal, this is the lingual, and this is the mesial, and this is distal. You are going to place on the buccal surface from the mesiodistals, from mesial side. Buccal surface, mesial side. Here you are, and the palatal. You are going to place it here, and then you are going to cover it like this. The strips are joined slowly and gradually at the distal side by hooking it around the distal most tooth. What you are going to do? You are going to hook the strip at the distal side, distal end. You are going to join it at the distal end by hooking it around the distal most tooth, and you are going to apply a gentle pressure at the facial and the lingual surface of the pack. You are going to apply a pressure like this so that it will going to be placed properly. You are going to place a pack, you are going to place from the buccal to lingual, or you are going to place a lingual to palatal. You are going to place it from the mesial side, and you are going to hook it up the distal side, okay, and you are going to gently press the packs from the both buccal and lingual surface. So this is the technique how you are going to apply a dental or periodontal pack. So this was the ending of the lecture. So if you like the video and understood well, please subscribe and share this video to your friends and your batchmates for easy learning and better understanding. If you want to know more about me, links are in description, and keep watching Pen Dentistry. To get the latest video updates, you have to press the bell icon. You can also get the latest updates on Telegram. For joining the Telegram, links are in description box. Keep watching Pen Dentistry.